was at McGill University for medicine. I did UCSF family medicine and worked in a variety of settings, including a primary care clinic at a mental health facility, residential housing, primary care, and then more just straight hospital medicine lately. And I can just from there, I'll just go into my talk if it will sort of tell the story from there.
That'd be great. Thank you.
So let's do this here, share, and then present. Here we go. Okay. Yeah, so I'm Leif Hass, and I just want to share with you how I got interested in social prescribing. You would sort of hospital is sort of usually where you go and patch people up and you kick them out, and then notorious for just addressing the acute need and not taking a deeper look into what's going on. Uh, and I guess what I found over the years is that I would come and see my patients, and I would give them some antibiotics or a diuretic, and I would, typically my patients are older. They often have chronic uh, health conditions. And oftentimes, as a result of their age and their illnesses, they are less engaged in society than they would be. And I find that what I was doing is I would be able to get people treated and get their breathing a little bit better, and kind of get them on track and get them out the hospital. And I had this feeling walking into the room sometimes that like, is that really what the patient needs the most right here? I really need it. I mean, I've got that, but I'm just like barely scratching the surface of what needs to be done here. And so I started brainstorming with this colleague of mine, Dacher Keltner, who is involved in this Greater Good Science Center at UC Berkeley. And I'd been started to do some writing about prosocial motions in healthcare with them. And we came up with this idea of why don't we just think about, let's identify 10 different things that we know benefit people's, they're measurable benefits to a person's health that also has some immediate gratification. So here's something like prescriptions I could be giving my patients where I can say there's measurable health outcomes and it will make you feel better in the process. And it will be a way of addressing more than I typically do when people come in for a day or two in the hospital. And so I got a draft of these prescriptions going a couple of years ago now. And I'll just tell you a story about what happened a couple of years ago during COVID. So this was during COVID. I got asked to see this guy, Mr. W. Um, when I get it, it's just like a little one-liner about this guy, 62-year-old guy with heart failure. And I walk in the room, and he says to me, Dr. Hass, it's so great to see you again. Oh my God, just want to tell you, you saved my life earlier this year. And I'm like, look at the guy, like, damn, who is this guy? Scratching my head, trying to make, how it is when you don't remember somebody and you're trying to pretend like you remember them. And I'm like, was it the antibiotics I gave him? Maybe it was I got him on his heart failure meds and I couldn't quite figure it out. And he goes, yeah, remember Dr. Hass? I was in 3 months ago and I was so depressed from sitting in my room and I'd stopped taking my heart failure meds. And I got to the point where I almost needed to be in the ICU because of my heart failure. And you came in and we talked about, you sat down and you gave me a prescription to ride my bike to watch the sunsets. And I got out of the hospital. I was breathing better. And I told you that I used to ride my bike and I got my bike. I kind of fix it up and I ride it down to the Berkeley Marina every day and watch the sunset. And I just was like a new person. I wouldn't have made it through the pandemic without you. And it kind of came back to me that like I had done this, but it became also apparent to me like, wow, you know, I had done other things for this guy. I gave him some pills and got him breathing again. But what he remembers, what really was transformational for him, was the fact that he got outside and got fresh air and got some exercise. And so that was I'd been doing this, and this was the moment was like, okay, this can really make a difference. And I've had similar experiences since. I walk in a patient's room about 6 months ago, and I saw her name. I remember her, and I saw her name on my list. And my heart sank. I was like, oh my God, Miss Ochoa is back. Oh, a young woman with cirrhosis from drinking. And I walk in the room, and my prescription's in her book. And I'm on a Zoom meeting, Dr. Hass. I'm in my recovery meeting. Thanks to you, you told me to get out, call some friends, and go for walks. And now I'm doing Zoom. I've never seen anyone do a recovery for alcoholism in the hospital before. And we both cried. You know, so it was not, how many times did she be told to stop drinking? Oh my God, a million times. What did it take? Go for a walk with a friend. Talk with someone who cares about you. Get some fresh air. So this, among other examples, I don't follow up with my patients. I can't, get arrange for a group to go to the museum or do things, but I give out these one-off prescriptions, and I can tell you what I've seen is, my prescriptions for hydrochlorothiazide never ends up on someone's Instagram or Facebook or on their fridge, but I get it all the time. Oh my God, that prescription you gave me, I gave it to my pastor. They're talking about it at church. And so this is what these prescriptions look like. These are my prescriptions for health and happiness. They're not exactly all social prescribing in the standard sense, but this is what I give out. I give out old school paper copies, rather than something put up in like I could put something on Epic, and it's just not the same. You know, this kind of thing here, I say, put it on the fridge, show it to your friends, help someone do these things. I'm not sure how much time I have left, but I guess that what I would say is that, a lot of what I'm addressing here is this paradox. People isolated, and the more they get isolated, the more that they begin to detect, see the world as full of threats, right? And that hypervigilance leads us to be preoccupied, makes us less likely to reach out. And so when you are lonely and get in these isolated states, it has a way of perpetuating itself. And I see these prescriptions as sort of an antidote to this process by giving people an opportunity in a way to get out and do things. I guess what I will often prescribe is to volunteer at the food bank, drive for Meals on Wheels, try to figure out some way to help other people, even if you're not well yourself. You can, I had colleagues of mine or patients of mine just call around to other parishioners in their church and make sure they're doing okay during COVID. I think my favorite prescription is giving out a prescription for joining a church choir. And I'll tell them, you don't have to believe in God to join your church choir. You may have been gone years ago, but I think there's few things better for you than singing with other people. And what I usually start with my patients is like, well, tell me what brings you joy. Before you got sick, what did you do that made you happy? So I just start with a few open-ended questions and see what I get with these folks. And you have them help me come up with what's going to work for them. I guess what I would, one of my heroes is this one, Barbara Friedrichsen, who has wrote this great book called Love 2.0. And I think it's an idea where we sort of imagine what love is. We have this idea that love is this, it's something you live and die for your partner. There's blood and family ties, but love is, we should think about love as an emotion and think about the way our body thinks about love. I think the way we think about love is actually more of to get complicated. It's not what love is sort of trust we develop over time with people, right? And what love is, the emotion of love is this good feeling you get around someone you care about. And you can get this feeling about anybody. You can have this feeling of love about the cashier at the cafeteria, about your mail person, anyone you run into. If you get that kind of good feeling, that's a little bit of love. And it's those little bits of love that weave the fabric of society and give us the resources and the strength we need when times get tough. And so I have this idea that I talk to the doctors I get training now. I say, you get paid to love people. Right? You walk in there, you give them a little love, lead by example, and then talk with them about ways that they're going to try to get more love in their life. And these prescriptions are sort of the pathway for doing that for me.